I had a specific dyadic exercise intervention, dyad meaning two interrelated participants. And in this exercise intervention, I asked the cancer patient and their caregiver to exercise together in one arm, or they were randomized in an arm where the cancer patient exercised alone and the caregiver was asked not to change their behavior in any way. And the idea behind this is exercising is unpleasant. A lot of people don't like it, but it's marginally more pleasant if you can have somebody else there exercising with you. In addition to helping people to adhere to exercise, this could also produce additional support for both participants in the dyad. So I had a couple of different outcomes, cancer-related fatigue being one of the primary ones, psychological distress being another one, depression and anxiety symptoms, and also we looked at physical function as measured by a number of physical function tasks, and inflammation as measured by a blood draw and serum cytokines. We gave a two-part exercise intervention. It's called Exercise for Cancer Patients, or XCAP. And the two components were a walking intervention, where we asked patients to increase their number of steps walked by between 5 and 20% per day. And that was given so that if people had additional fatigue on a particular day, they could increase their steps walked by 5%. If they felt good and energized, they could increase their steps walked by 20%. So that was one component. They also were given resistance bands, which are like big rubber bands that they use to do strength building activities. And they were given a manual of different exercises to do. We noticed that cancer-related fatigue definitely decreased over the course of the intervention, regardless actually of whether you were in the dyadic intervention or the survivor-only intervention. Depression also decreased in both the dyadic and survivor-only intervention, but we did notice that for those who were randomized to the dyadic intervention, where they exercised with their caregiver, there was a steeper decrease in their psychological distress or depression. So there's some preliminary evidence, again, this is a small sample of 20 people, 20 survivors and 20 caregivers, but some preliminary evidence that dyadic exercise may address psychological functioning. I think it's pretty safe to say it's good to exercise with somebody else to get that social support on board. Obviously, from a research standpoint, we need a larger study with a bigger sample to really show that this is effective. But my recommendation would be for those cancer centers and supportive care clinics that are providing exercise, consider incorporating more than just the cancer patient into those programs. So get a caregiver on board, whether that person be a romantic partner or an adult child or a parent, and have somebody else get involved in a tangible activity to support the survivor or cancer patient. I think there are a couple of advantages to that. One, we see that there may be some additional benefit for the cancer patient or survivor. Two, it gives the caregiver an actual activity they can engage in to support the patient. A lot of times caregivers will say, we want to be there for the patient, we want to help, but we don't know what we can do, right? The patient is going through treatment on their own, there's nothing we can do to help that. Here we're saying you can exercise with the patient and that will improve their outcomes. We have seen our exercise protocol be effective for patients with all kinds of comorbidities, illness states, ages. We had somebody who was 82 in our study exercising and doing it effectively. Because we tailor the intervention to the specific fitness level of the patient, thus far, we've seen no negative effects of the exercise. Of course, to enter into our research studies, people also have to get clearance from their physicians that they have no medical contraindications to exercise. So, if someone's considering going in and starting an exercise program, they want to have a physician check them out first to make sure there's no cardiovascular issue or other comorbidity that could impact their health. My take-home message would be, if you're treating a patient or a cancer survivor in a supportive care clinic, consider what other support structures they have around them. Think about their caregivers and think about how you can leverage the support from those caregivers to improve the patient outcomes.